Hi, I'm Dr. Eileen from Tend, and today we want to talk about endometriosis. Endometriosis affects about 10% of women, and you may not know what it is. The endometrium is the lining of the womb, and that's the bit that actually sheds when you have a period every month. What happens in endometriosis is that the lining of the womb finds its way outside of the uterus and ends up sticking to different organs, usually inside your abdomen or inside your pelvis, which gives you lots of different symptoms. The type of symptoms that we're talking about are painful, heavy periods. The pain can occur at times other than when you are actually having menstruation. There are things that you can do about this yourself. You could try using some over-the-counter medications. Anti-inflammatory drugs like ibuprofen, naproxen and diclofenac can be bought over the counter, and you could always try these first before you decide to go and see your health professional to discuss this. If you find that that isn't enough to control your symptoms, the next thing that you should do is go to discuss with your doctor whether you need to have any investigations. Most people don't need to go to the point of having a laparoscopy, which is where a doctor will put a little camera when you are asleep in through underneath your belly button and have a little look inside your abdomen to see if they can see any patches of endometriosis. That's really only in people who have the most extreme type of symptoms. Endometriosis can be quite difficult to diagnose because it does mimic the symptoms of lots of other things, and you can have painful periods without having endometriosis. If you think that you have a problem, you can always go and see your GP and be referred to a gynecologist to see if you need further investigation. There are many other conditions you may need to have eliminated first, and you may need to have some blood tests, and you may need to have a pelvic scan before you actually get to that stage. In extreme cases, it may be that you could use other hormonal methods to control your symptoms. An IUD can give out hormones, which can often control your endometriosis, and some people will take drugs which are only prescribed by a gynecologist. If you think you have any problem like this, please go and see your healthcare professional, your GP or your practice nurse. If you know that you've had endometriosis and you are having difficulty getting pregnant, it is important for you to get in to see a gynecologist quite early, because we do know that existing endometriosis can reduce your chances of conceiving.